As far as prevention is concerned, there are certain things that are important. For example, one of them would be to be aware of what activities the child is doing, especially in boys. What type of instruments they're holding, what type of toys they're playing. And in situations where they're wearing glasses, for example, the choice of the glasses is also just as important, because any injury that can injure the lens can also injure the eye. And with the proper choice of lenses and frames, you can minimize injuries to the eye in that situation. The American Academy of Ophthalmology and the American Association for Pediatric Ophthalmology recommends that all children should have a full eye examination by the time they're 3.5 or 4. And the reason for that is because there are certain conditions in the eye that may not be obvious at that age, that you can't detect without doing a full eye examination. So that's really the recommended time to do that. Now, having said that, I think it's also important to look for certain things in children. What are things in children that would prompt the parents to bring them in? Well, there are certain things that you can kind of keep in mind. For example, when they tend to squint to look at certain objects, or when they tend to close one eye when they look at certain objects, or when they see abnormal movements of the eye or the lids, for example, or when they see that the eyes are not properly aligned. Those are things that should clue you in that there's something wrong.